2003, I sat in the emergency room with my mom as we were very compassionately told that my dad, her husband of 59 years, was dying of an inoperable brain tumor. I later relied on Theda Clark Hospital in the many visits my mom had as her health failed, and in the next years after that. Just over a year ago, my mother-in-law passed away rather unexpectedly at the hospital, and we were blessed by the care and compassion we received throughout that really trying time. A hospital is filled with stories and some of the most powerful emotions that we ever experience in life. The story of our Theda Clark Hospital is one that began with the sorrow of loss, but that loss was transformed by the generosity of a family who cared deeply about this community. It's a story that's important to us as a community because our lives and our stories have filled it. For generations, our health and well-being have depended upon this hospital and the caregivers who work within it. Our current circumstances make us very mindful of the great gift our community received over 100 years ago. We're honored tonight to be able to share some of the inspiring history of the ThedaCare story with you, and we're proud to be welcoming Dr. Jennifer Frank, Chief Medical Officer for ThedaCare, as our presenter this evening. Dr. Imran Nandrabi, the current President and CEO of ThedaCare, was unable to join us tonight, but we're extremely thankful for Dr. Frank's willingness to be with us. Dr. Frank is a family physician who has been with ThedaCare for approximately 9 years. She has held the roles of Senior Medical Director and Associate Medical Director of ThedaCare physicians. She continues to practice family medicine at the Neenah Clinic, where she finds particular joy in doing well child exams for children she delivered and taking care of the entire family. Prior to joining ThedaCare, Dr. Frank was an associate professor at the University of Wisconsin School of Medicine, go Badgers, a faculty member of the UW Family Medicine Residency Program, now Mosaic Family Medicine Residency Program, and medical director of the residency clinic. In 2008, she completed a fellowship in faculty development through the University of Wisconsin. Dr. Frank received her undergraduate and medical degrees from Boston University and completed her family medicine residency at Fort Belvoir DeWitt Army Community Hospital in Northern Virginia. She was an Army physician for 7 years and was stationed at Fort Belvoir, Virginia, and Fort Benning, Georgia. As Chief Medical Officer, Dr. Frank plays a key role in ensuring ThedaCare is living up to its mission to improve the health of the communities it serves and its principle of putting its patients first. Please join me in welcoming Dr. Frank.
Jane, thank you so much for that introduction. I am going to, okay, I just want to make sure there's no echo. Excellent. That is such a lovely introduction, and I really appreciate the personal story related to your experiences at ThedaCare Regional Medical Center, Theda Clark Hospital. I have many of my own. I did deliver my youngest child at Theda Clark, and we had something then that they did not have back in the early 1900s. They had the helicopter pad, and our room overlooked that. So my other 3 children were entertained more by the helicopter taking off and landing than they were by their new baby brother. So as Jane said, my name is Dr. Jennifer Frank, and I am a family physician just down the road at the Neenah Clinic, and then have the honor of being part of the ThedaCare leadership team as well. I'm also a proud resident of Neenah for the last 14 years, along with my husband Ben and our 4 children, who are ages 11 to 18. While I am not a Neenah native, I do consider Neenah my hometown. It is a special place, as Jane mentioned, with a palpable feel of commitment to community. It is the type of city in which people are committed to the success and well-being of all citizens, rather than solely focused on what is good for them. I interview a lot of physicians at ThedaCare as part of my role, and I am inevitably asked my favorite question, which is, why do you work at ThedaCare? I describe the unique nature of both ThedaCare and our medical community, both of which reflect the larger culture of the Fox Valley. ThedaCare has an unbroken legacy of working to improve the health of our community, which you will see started with Theda Clark Peters 111 years ago. That mission is shared by everyone at ThedaCare. It is a singular community of people who care deeply about their communities. They work diligently to provide the very best, most compassionate care to our patients, who are our friends, our family, and our neighbors. This commitment is not just a slogan or a slide or a picture on the wall. It is the framework for our conversations around the boardroom or the care we provide at the bedside. We are so fortunate as well to enjoy a larger medical community that is part of our mission. Our affiliated medical staff at our hospitals are passionately devoted to our community in ways both directly related to healthcare and to influencing the overall well-being of our neighborhoods and towns. I'm pleased to be able to share a PowerPoint presentation with you as well as some videos. I'm going to try to keep it conversational, but I think you'll find some of the information I have to share to be interesting. So I am going to share my screen. Excellent. Okay. Perfect. Okay. So this is a picture of Theda Clark Peters. And again, she really embodied the mission that we still have today, 111 years later, which is to improve the health of the communities we serve. I believe that Theda Clark Peters, who was likewise devoted to Neenah and the well-being of her friends, family, neighbor, and community, would be pleased with the work we are doing today. And I would like to share a video with you which presents our noble legacy in her own words.
On my 16th birthday, my father, C.B. Clark, told me, "Life is very short, and we must not lose any time, for it is gone too soon." Dearest Papa worked hard for a living, setting a good example for our family. He was a Civil War soldier, one of the founders of a big local company, Kimberly and Clark, mayor of our hometown. He sent me adoring letters as he fought for women's suffrage in the Wisconsin Assembly and U.S. Congress, calling on me, his best big girl, to become a grand, good woman. He wrote, "Young women of the times must be more than their mothers or as men. They must be more." I know Papa would have been proud to see me graduate as one of only 7 women from Wells College in New York. Sadly, he died of Bright's disease less than a year earlier. I knew it was my duty to help build a thriving, healthy community. I devoted myself to this goal shortly after marrying. My love of reading, writing, and children made a public library my first priority. My love of arts and culture made an opera house next on the list. My greatest gift would be born of tragic events. Death came, all because we were without a local hospital. First to an ailing neighbor, then to a dear friend and her baby. As a pregnant woman, I wanted to ensure that even if I left this earth, I would continue helping others in my community. In my private instructions to my brother, C.B. Clark Jr., in my will, I said, "If I were to die in childbirth, use half my estate to build a hospital and a school of nursing to ensure access to health and care." On October 18th, 1903, I gave birth to a healthy baby girl and carried on our family name of Theda. But my fate was not for me to decide. 3 days after my sweet baby came into the world, I died from complications of childbirth. I left my family this letter, only to be given in the event of my death. My husband, I hope that I am leaving you the greatest treasure that a woman can give to her husband, a child, to love you as long as you shall live. Teach our child to know me as mother somehow. Teach our child so much of good that the evil of life can find no place in its heart or head. I shall wait for you and try to watch over you somewhere. My vision for my community has been honored. On my daughter's 6th birthday, ThedaCare opened its first doors, ensuring care and health for generations of families to come. Over a century later, my legacy lives on in ThedaCare, with hospitals and clinics, physicians and staff, improving the health of the people in the communities I loved.
Great. I hope you enjoyed watching that. I've seen that a number of times, and it always is just very deeply moving because of the work and the vision of this remarkable woman. And I am so pleased that our organization still is known by her name. It's just a wonderful legacy. This month, as the video said, marks the 111th anniversary of our first doors opening. As was shared in the video, the legacy began right here in Neenah. However, over the years, it has spread to now include over 180 points of care within 17 counties, providing care for 600,000 residents and having approximately 7,000 healthcare professionals as part of the ThedaCare team. If you are interested in those videos, which I assume you may be, given that this is for the Historical Society, there are a number of other videos on YouTube, including histories of our other hospitals. While our mission has not changed in the last 111 years, how we carry out that mission needs to change for us to thrive in the next 111. This is the ThedaCare logo with some additions. Certainly at the center of our focus is our mission and our vision, which I will share in the next slide. However, there are many elements of our focus that are required in order for us to achieve our mission and vision. And most important is people, both the people that we take care of, as well as the people who are the caregivers. Our culture, as I mentioned, had very firm foundations with the gift and generosity of Theda Clark Peters, and is nurtured by a larger culture within the Fox cities and within our counties, surrounding counties, that is really devoted to the well-being of our communities. Performance is something that we take seriously because it is the way that we know whether we are successfully delivering on our mission, vision, and promises. And finally, value is something that you'll see me talk about throughout this presentation, because things have changed since ThedaCare initially opened. Healthcare finance is a completely different experience, and for many people can add to the stress of a medical illness. So at ThedaCare, we are committed to providing high value. Just like if you were to buy a car, you want to get the highest quality, highest safety car for the best price. You do not want to sacrifice quality or safety in order to be able to afford that. And likewise, we want your healthcare to be the highest quality, the safest, at an affordable price. Our mission, as I said, is to improve the health of the communities we serve. Our vision is peace of mind for all we serve. Now, peace of mind is usually not something people think about when they go to the hospital. When you go to the hospital, you may be sick, you may be in pain, you may be scared, you may have to undergo uncomfortable procedures, and there may be a lot of uncertainty about next steps. Unfortunately, people go to the hospital and sometimes pass away in the hospital. It is not considered a place where peace of mind thrives. We can't take away the fear of the unknown or the heartbreak of losing someone. But what we can do is provide peace of mind for the people we care for. I think about several years ago when my, at that time, young son was having a respiratory illness and continued to get progressively ill. Throughout the night, he developed worsening shortness of breath, and I realized that he really needed to go to the hospital. Even though I'm a doctor, I actually think I have more anxiety about healthcare because I know of all of the things that it could be or could mean for him. So I took him to the ThedaCare Regional Medical Center, Neenah, where he was evaluated by an excellent team of emergency medicine professionals. He was cared for by radiology techs and the pediatrician who admitted him to the hospital, as well as the nurse who cared for him while he was admitted. Throughout this entire episode, multiple people provided peace of mind, not only for myself, but also for my son in big and little ways. Everything from taking our concerns seriously and making sure my son got the right care, to letting him pick out a stuffed animal after he got his x-ray, and making sure that I was comfortable as I spent the night with him. Those are the types of things that we can provide and aim to provide. When you enter one of our facilities, we want you to feel 100% confident and comfortable in the care that you're receiving, and feel confident that we are going to provide the highest quality care for you. In order to achieve our mission and vision, we have engaged in a population health strategy. Population health is a very common term now. It's very in vogue. It's been around for a while, and truthfully, it's not really clear that anyone knows what it means exactly. Population health is something many organizations are embarked on, as we recognize that our old model of providing care episodically, illness by illness, is no longer the right way to provide care. We aim to be a full service population health organization, and we aim to lead the nation in this. We will be providing world-class, consumer-focused, affordable, high-quality care close to home. We will do this by focusing on a high-value network, developing our market, optimizing care, and developing strategic partnerships. Population health is really caring for the health of a population, which I know is not an excellent definition, but is really looking at our patients not just individually, but as individuals within a larger population that we serve. And when we talk about population health, it's not population disease. We are not just preventing people from dying or having surgery or adverse events. We are trying to promote health and prevent the need for many of our current services. Part of this, like I mentioned, is to have a high value network. That means that we are integrated across a network of different places to receive care, so that we can partner with payers to make sure that the reimbursement and the way that we pay for that care is rewarding the right things. And rewarding the right things means making sure the people we care for are as healthy as possible, and that we reduce the total cost of care. We also want to make sure that our populations have access across multiple points of entry. In addition to our traditional clinics, hospitals, etc., we also want people to be able to access through non-traditional means, such as telemedicine. COVID has been unique in propelling us forward within the realm of telemedicine, and we are learning a lot about how to do this well during this time. We also want to make sure we're optimizing the care our patients receive, and that includes making sure we have the right level of services our patients want in their communities. When they need a higher level of care, we want that transition to be smooth. One of the things I think we're most proud of is a very, very clear focus on bringing care to the local areas whenever it can be done, maintaining high quality and safety. This includes things like orthopedic surgery, cancer care, general surgery, obstetrics and gynecology, all delivered in the communities in which our patients live. And finally, partnerships. We recognize that we cannot take care of a population by ourselves. We are fortunate that we live in a community where the commitment to each other is already strong, because we will need to build on those strengths in order to truly serve our population well. I'm going to show you another video, and this video really is, the previous video is really looking backwards. This video is really looking forwards. And again, while much has changed since Theda Clark Peters established ThedaCare, when you think about some of the letters and the things that she wrote, she was looking for what we're still looking for, which is health, safety, and local care.
Your family, their health, your peace of mind. It's your world. A world you care for and protect. There's no greater hope for the future of our community than for their health and well-being. Imagine a world where that comes with ease. Imagine if you had the tools to predict and prevent health issues from arising for you and your loved ones. Where you have access to health experts and answers. Where caregivers and partners know the unique needs of you, your family, and our community. And create personal care plans based on your individual genetics, risks, lifestyle, and goals. Where they care for your physical, emotional, and overall well-being. Any time of day, throughout all stages of life, and without hesitation. Imagine if that kind of individualized care and protection was not only accessible, but affordable. Easy, individualized, and empowering. It's a vision for the future. It's a path worth paving. Because the health of the community isn't just about numbers. It's about a vision for a healthy future. A vibrant future filled with wellness and vitality, growth and prosperity for all. Where everyone has access to high-quality, high-tech healthcare that can be found with the simple touch of a screen or in person when you want or need it. Population health. One family, one community. We are building our future together, empowering our community to live our best lives through better health.
What I hope you can appreciate from that video is that something we firmly believe, which is we can do this better. We know that there are a lot of challenges in our healthcare system. COVID has actually revealed a lot of strengths, but also a lot of weaknesses and opportunities in the way we currently deliver healthcare. And it is my sincere hope and the hope of our organization that we will use this experience that we are going through as a global community to propel healthcare forward in important and meaningful ways. There are two primary reasons for our current healthcare situation, and you know from reading the paper, personal experience, watching the news, or listening to people who have opinions about healthcare, speaking on television or the radio, that we have a healthcare crisis in this country. Both industry economics and changing consumer behavior and expectations are contributing to our current healthcare situation. We spend a lot of money on healthcare in this country. Currently, we are spending $3.75 trillion on healthcare each year in the United States. Within the next 5 years, if nothing changes, we will be spending $4.7 trillion a year. And in the next 10 years, it could be as high as $7 trillion a year. This is not sustainable. Wisconsin has many things to recommend it, including quite good health outcomes, but we also spend money in excess of the US average to get those health outcomes. As you can see, overall healthcare spending has increased over the last many years, and Wisconsin's increase is outpacing the US average. What we are seeing is that there is an increase in healthcare premiums, as well as an increase in how much workers contribute to their healthcare premiums that far outpaces the amount of insurance reimbursement. The amount of money that households in this country pay for healthcare is astounding. In 2002, the average household paid $9,000 a year for their premiums and out-of-pocket healthcare expenses. 4 years ago, that rose to almost $26,000. And if things remain the way they are, if they continue on the same trajectory, it could go as high as $50,000 a year. Many households cannot bear this kind of financial burden. We know that something must change. So we're spending a lot more money in healthcare. So where's all that money going? We already talked about who's paying for healthcare. Patients are paying for healthcare in terms of premiums and out-of-pocket costs. I know just as a family physician, I used to never have to speak to my patients about healthcare costs. It just wasn't that much of an issue for many people. And now it is a rare conversation I have that does not touch on cost to some degree. Employers, as you saw, have rising premiums, again, sometimes outstripping the pace of their own industry growth. And government costs are rising in terms of Medicare and Medicaid services. Hospital systems are realizing either flat or declining reimbursement at a time when hospital expenses, staff expenses, and needs for capital and equipment are increasing. Physicians have recognized a modest increase in reimbursement. In some cases, an effort by the government to direct reimbursement to services that promote prevention in population health. But those really profiting from healthcare in our current situation are health insurance companies, as well as drug and device companies. And this is something that, again, is well recognized in our society in an area of much government interest and attempts at regulation. 4 health insurance companies recorded a $7 billion profit in a single quarter. This is an example of how the payment for healthcare is really disproportionately borne by patients and employers and disproportionately redistributed to health insurance and drug and device companies. Consumer expectations are changing. I had my first video visit with a patient on Monday, and it was a different experience. It was very convenient for her, and it actually was quite convenient for me. And it was particularly convenient because she was on quarantine because of COVID exposure. COVID has really helped us to find out in more detail what our patients want and expect. The healthcare industry is undergoing a lot of disruption, both by competition as well as consumer attitudes. New technology has changed the expectation of our consumers. Like many areas of our life, we expect healthcare to be immediate and that information is available to us right away. We're also facing new retail competitors such as CVS, Walmart, Amazon, who do not have all of the encumbrances of a traditional system and who are paving a new path in many ways. Our healthcare system, like all healthcare systems, must adapt to these changes or we will fail. As a physician, I would love to think that I have a heavy, heavy influence on my patient's health, but the data would tell us otherwise. I might spend 20, 40, 60 minutes a year with a patient, and that is not nearly enough to influence their health more than where they live, what they eat, and what their genetics say. About 20% of health is related to traditional health care, your access to health care, the quality of the health care you get. Other factors determine the 80%, the other 80%. While genetics are largely out of our direct control today, the rest of the factors are at least within our ability to influence. 30% of your health is related to your personal behaviors, whether you smoke, what kind of food you eat, whether you exercise, are you sleeping, those kinds of things. And those are all largely under your influence. 40% is related to social and economic factors. And I think we're at a point in our country's history where we are coming face to face in a very real way with the inequities and inequalities in our society. This is where it shows up, and you can see it has the largest impact on patients' health. Social and economic factors can include things like education, employment, income, and even social support. And finally is the physical environment. 10% of your health is based on your physical environment. Do you have clean air, clean water? Is the area around you safe? Do you have safe housing? What is your transportation like? So you can see that as ThedaCare looks at these numbers, recognizing that we have control over perhaps 20% of our patients' well-being, that we must partner not only with our patients and our consumers, but also with people across our community to make sure that we are providing health across all of these domains. Therefore, we're really looking at transforming healthcare from a place you go to get care to a partnership that promotes health across the population. We continue to invest in the communities we serve, including throughout the COVID pandemic, and these initiatives directly tie to our aims around population health. In June, we launched the Ripple app to the community through a company called Be Well. Through this app, people have the ability to coordinate health information across providers, pharmacies, and healthcare systems. So it is not just your ThedaCare information, it is your health information. Everyone who downloads Ripple and registers can access their provider and insurance information securely. You can manage medications, receive alerts and reminders on future care needs, what immunizations you need, and what preventative care you're due for. Ripple also can keep wearable health devices in one portal, so your Fitbits, your blood pressure monitors, scales if they're Bluetooth enabled, those kinds of things to help identify your health trends. Recently, I was on Ripple and it told me that I had only been walking 3,300 steps a day recently, which in all fairness is because I don't always have my phone on me when I'm walking, but point taken, Ripple. And it told me that my goal should be 3,800. Could they just get me to 3,800? So the app told me, hey, let's work on a goal for you to increase that. And that is one example of how they can use health information, not just to store it and record it, but to encourage healthier behaviors. And finally, Ripple serves as a dedicated source for COVID-19 information, which I think we all are interested in at this time. We also talked about access and market and partnerships, and that's where our Orthopedic Spine and Pain Center comes in. In August, we broke ground on a partnership between ThedaCare Neuroscience and Hand to Shoulder on a new orthopedic spine and pain center located at our Encircle Health campus in North Appleton. A highlight of the center is a ThedaCare Orthopedic and Spine Hospital, which will consist of operating suites designed for and dedicated to orthopedic and spine surgery, 25 inpatient beds, as well as support services such as imaging, lab, pharmacy, and dining. This 230,000 square foot center is expected to open in the summer of 2022. It will create 75 new healthcare jobs, as well as the equivalent of 200 jobs within the construction sector. Demand for services of ortho, spine, and pain are expected to go up. This is part of how we take care of our population, is recognizing that our population is aging and is also more active. So the need for these services is also projected to increase. As demographics and expectations of communities shift over time, health systems must change to meet the changing needs, which is an excellent segue into COVID-19. This is a health issue that has required tremendous adaptation on all of our parts. We have adapted in ways that previously are unimaginable. My children are schooling at home. My husband and I have not been out to eat since February, and our offices at ThedaCare are somewhat lonely as many people work from home. And I know that all of you are likely experiencing similar disruptions to your normal life. ThedaCare has been preparing for the impact of COVID-19 from the very beginning. I remember being in a meeting, I believe it was in January, as COVID was just becoming apparent, and even at that point talking about what was the implication for our health system and our community. Since March, we have had an all hands on deck mentality where we have regular incident command. Incident command is kind of our command center to make sure that all of our services and needs are cared for across the organization. Those include things like making sure we're coordinating with public health and other health systems, making sure we have enough beds and ventilators and staff to support patients, and also making sure that our team members are healthy, safe, and well. Patients and families should rest assured that they have access to safe care. We have done a lot to make sure that our facilities are safe, first for our team members and then for our patients. Care needs to continue to make sure patients get the very best outcomes. Unfortunately, one thing that's been learned across again, globally, is that there are a number of adverse health outcomes attributable to COVID that occur in people who do not have COVID. So things like heart attacks and strokes, many people are experiencing those but not going to the emergency room because of fear of acquiring COVID, and then suffering serious consequences as a result. So it's very important for us to make sure that our community knows that we have done everything possible, everything recommended by the CDC to make sure that our buildings, our facilities are safe. These include things like visitor restrictions, screening everyone before they make an appointment and at the entrances, cleaning our facilities, our rooms, our equipment, and making sure we're promoting physical distancing in registration areas. We've also expanded our online health services quite significantly so that when it is appropriate and safe for someone to be able to receive care at their home or from their home, that they are able to do so. We've also opened a number of respiratory care clinics that are devoted to patients who may have COVID-19. This is done so that we can make sure we're minimizing the exposure of people who are coming in for non-COVID related care. We've also been able to centralize our expertise around COVID at these sites. We've also tripled bed capacity across our system to accommodate extra patients, and this includes ICU capacity and ventilator capacity. We have a number of digital health resources to monitor symptoms, including an online symptom checker where whether you're a ThedaCare patient or not, you can get online, go through your symptoms and identify what is the best place for you to get care. We have a community hotline that serves, again, people across our community, whether they're affiliated with ThedaCare or not. And we have virtual care options, including e-visits and video visits. We've also partnered with local organizations such as the United Way to implement programs to support our communities as they are suffering at this time. And finally, we are committed to serving our team members. A lot of our team members are managing their own personal challenges during this time. Their illness or the illness of a family member, problems with transportation, problems with homeschooling their children, etc. And we have risen to this challenge to make sure that we are providing school support, childcare support, transportation support, food support, and we have created many team member programs to do so. Unfortunately, unfortunately, Wisconsin is making the news because we have a very high rate of COVID in our community. This is an indicator of the percent of patients who are positive based on all the people who get testing. We test patients who have symptoms, and we also do some screening for patients who don't have symptoms. Probably a couple of months ago, our positivity rate was about 5%, 5 to 10%. It's thought that if your positivity rate is less than 10%, you're doing enough testing to get a full appreciation for how significant the disease is in your community. So you can see that we have a lot of cases, and we probably are not capturing all of those with our current testing. This is the graph we hoped we would never see. 9 of the 9 Fox Valley counties are red as far as the cases per 100,000. We have made the New York Times list, not the bestseller list, but the COVID list with the Oshkosh and Neenah communities, as well as the Appleton and Green Bay communities for the number of cases per 100,000. As part of our COVID planning, we have modeled the surge. So that like spike in cases, which we call the surge, we have looked at possible scenarios, again, since the early part of the COVID epidemic. As we've gotten more data, more information, we have adjusted this curve, and this is used primarily for planning to make sure that we are ready for any eventuality that comes and visits our community. You don't have to worry so much about the RT and the 1.2, 1.4, 1.6. Roughly, it is basically how contagious or how much infection is occurring as a result of COVID cases. This cone, if you will, between 1.2 and 1.6 is where we projected we would be between a best case and a worst case scenario. And you can see, unfortunately, we are exceeding what we projected as the worst case scenario. This is using similar information, but this is projecting our hospital census, so what we expect with hospitalizations. And again, you can see that we have gone above what we thought would be the best case scenario to include a number of cases that are approaching that worst case scenario. We model this out, and the way that we use this data is we plan and predict what we will need as far as services in the ER, in the respiratory clinics, and the hospitals and the ICUs to make sure that we're prepared to meet the demand that is facing us. The great thing about this is that we, the collective we as a community, can bend this curve. You remember back in the spring when we were all about flattening the curve, we have the ability to do that again. That is the good news of COVID, is that there is a lot we can do to influence how this plays out in our community. Speaking of which, if we wore masks, COVID infections would plummet. We know this because it has been studied. Again, early on in the COVID epidemic, there was a lot of confusion around cloth masks being used out in the population. We have seen mask and no mask cultures, both within different countries, as well as within different states or even different counties within the same states. They all look the same. If there is no masking or there is limited masking, we will see high rates of COVID cases. When masking is initiated, you will see the curve start to flatten and level off, in some cases actually bending down with fewer cases. There is no question that masks are an effective way to prevent COVID-19 infection. This is a very confusing graph, so I'll kind of give you the high level overview. This is looking at multiple different factors. This is looking at what's called the R naught, which is this R number. That again is just a measure of how infectious the COVID is. And that depends on a lot of factors, including the virus itself, as well as the population, how many people have already been infected, et cetera. There's not a ton we can do about that other than that flattening of the curve. On this, we assume the effectiveness of face masks. On this graph, we look at the population of patients wearing face masks. And here we look at wearing face masks all the time versus wearing face masks only when you have symptoms. Here you can see how we can decrease the effective rate of infection. So what this means is roughly how many people will someone infect if they have COVID on average. If it's 4, that means the average person with COVID will infect 4 other people. That results in exponential high growth. Conversely, when you get less than 1, you start to see a decline in cases. What I'd like you to see is even when the innate infectivity of COVID is present, we still have a tremendous amount of control if we are wearing masks all the time and all of us are in it together. So again, despite all of the confusion and the complexity of this graph, the message really is masks are effective if we are all wearing them all the time when we are not able to physically distance. In addition to wearing masks, there are other things that we need to do to prevent the spread of COVID. Those include physical distancing for people that are outside of your family or your immediate household. One thing that is being observed now is that many cases of COVID are being spread through small family gatherings of groups of people who do not live in the same household. So me going to visit my in-laws, small family gathering, but we don't live in the same household. It's a very effective way to spread COVID. Hand washing and good personal hygiene is effective. Cleaning frequently touched surfaces is effective. The primary way that COVID spreads is through droplets. However, it also can spread through touching something that someone has touched who has COVID, and then touching your face, your nose, etc. And then finally, good respiratory etiquette, covering your cough, your sneezes, coughing into your elbow, those kinds of things, again, to minimize the spread of any infection. What we know, unfortunately, is with COVID, one of the things that makes it particularly dangerous is that it is something that can be spread when someone has no symptoms. So we know that it's important that whether we're feeling well or not, that we are practicing these types of measures. This is a picture of my family. So you can see my husband, Ben, my youngest with his eyes closed is Caleb. Josh has his patriotic sunglasses on, and then my daughters, Rachel and Natalie. This is us out and about in the community wearing our masks. And I hope that if I see you out and about in the community, you are similarly wearing your masks. This is a great example of how we can work together as a group, as a community, to achieve better population health outcomes. We have the power within our community to impact how COVID behaves and how much infection is present. As you saw with the numbers, COVID cases rising threaten the ability of our healthcare system to provide care for everybody, not just those with COVID, and really can place a strain on our healthcare system. So we need your partnership, not just in our population health initiatives, but also around preventing the spread of COVID. So as I mentioned at the beginning, our goal is that our communities are healthy. Much like Theda Clark Peters started ThedaCare with that end in mind to make her community healthier, we hope to build on that idea, that vision, and realize that. Healthcare has changed a lot in 111 years, in many ways, very positive changes. However, we still hold that central mission to be true. The way that we do that going forward is through population health, partnerships across our communities, and centering our efforts not only on that 20% of health that we control within our walls, but also the other aspects of health that lead to the population being healthy or not. We are honored to be a part of this community. Thank you for trusting us with your health and your care. We look forward to partnering with Neenah and our Fox Cities communities in health and well-being, and empowering your families, our families, to live our best lives for the next 111 years. Thank you.
Thank you so very much, Dr. Frank, for your wonderful presentation. I learned so much, and just thank you for all that you do for our community, for keeping us healthy. We truly appreciate you and all of our healthcare workers at ThedaCare.
Thank you.
I have 2 children who work in healthcare, so I'm very proud of them, and I know what a difficult job it is, so thank you. I'd also like to thank Nicole and the Neenah Library for facilitating tonight's presentation. And thank you to all of you for joining us tonight. We hope that you learned as much as we did. We're all in this together, and I hope that you got that message loud and clear tonight. Again, next month we'll have Jim Gould and the author of 11 Miles to Oshkosh joining us, and that will be on November 19th, and we hope to see you then. I'd like to say as well, if you have any particular questions that you would like to ask Dr. Frank or anyone at ThedaCare, we would suggest that you email us those questions. We'll forward them on, and we will try to get those answered for you. We don't really want to start getting into a lot of questions for Dr. Frank tonight, and I truly think she did an amazing job informing us about COVID and everything else that we're faced with right now. So we really appreciate that. So with that, take care, everybody, and stay well. And we hope you have a good night.
And wear your mask.
Thank you.
Thank you so much for having me. It was a pleasure.
Well, thank you for doing it. What a great presentation.
Thank you. I'm